And we're live. We're live. Hello, everyone, and welcome to August's wellness class. I'm very excited about this class for a couple of reasons, which I'm going to share with you a bit later. We're going to jump right into it. And as I see people coming in, we'll probably keep recapping along the way. But even if you're not watching now, but you're going to watch this class at a later date, welcome. Karibuni sana. This is class number, I believe, class number 6 in my continuing essential wellness with essential oil classes. It's such a mouthful to say, but last month we did a class on nurturing femininity. And so the obvious progression for me then would be to talk about navigating pregnancy with essential oils. So I'm excited because we're being joined by someone who's not only my friend, but she was also my doctor at the time. And so we're going to get in a bit on that. What other things do we need to know? If in case you've not watched the previous classes, please make a point of going to my YouTube. They're all listed in a wellness classes playlist. You're going to find the progression of classes because every one of them has been building on from the last one. And so without wasting any more time, let's get right into it. Let me see how this gets done. This is the only disadvantage of doing a class. Okay, not disadvantage, but one of the things about doing a class live is you get to see the bloopers as they happen, which is not so bad. So this is an informational webinar like all my classes are. It's not intended to replace proper medical advice. This class is also particular to doTERRA essential oils because that's what I'm familiar with. That's what I have knowledge and personal experience around. And then as usual, I encourage you to practice due diligence and common sense and seek medical advice where it is appropriate. Please remember that essential oils do not claim to cure anything. They are just an additional supplement to your wellness lifestyle and should be treated accordingly. All right, keeping it moving. What are we going to talk about in today's class? One, we're going to talk about how to choose your healthcare provider. We're going to talk about why should you actually use essential oils in pregnancy. And then I'm going to talk to you about how to safely use essential oils. And then we're also going to have a session on addressing common pregnancy concerns and essential oil pairings. And lastly, we're really going to spend a bit of time on the one area that we both felt is strongly overlooked during the pregnancy journey, right? So I'm Brie Orata. I've been using doTERRA essential oils since 2015. I started using essential oils in around 2010. And one of the things I discovered along the way was that I'm passionate about teaching people how to use essential oils to support your wellness journey every day. I'm going to allow Dr. Flavia to introduce herself, to talk a little bit about what she does, and to talk a bit about her passions, and then we're going to take it up from there.
Hi,
Welcome,
everyone.
Dr. Flavia.
Hello, everyone. Thank you, Brie, for inviting me here. I've known Brie for a long time. We go way back. I'm Dr. Flavia Ogutu. I'm an obstetrician and gynecologist working in Nairobi, and I'm passionate about women's health. I'm specialized in something we call maternal fetal medicine, which is maybe in layman's terms, looking at high-risk pregnancies. And I'm happy to be here. Thank you, Brie, for having me.
No, I'm very excited. I'm very excited to have you here. And one of the reasons for me you are my obvious choice was because you are my doctor. So let me just show people that for real, I was pregnant. It is not a joke. It is not a myth. So this class is primarily based on my personal experience when I was pregnant back in 2020. And one of the things I knew without a doubt was that I was going to use essential oils. Like that one was never a question. It was not a matter of if, it was a matter of when. Or is it the other way around? Anyway, it was like a given thing for me. I knew I was going to use essential oils. And to be honest, pregnancy was wow. Pregnancy was, yeah, that's the only way I can do. It was like wow. It was wow today, and then it was like wow the next day. It was such a range of emotions. And when I found out I was pregnant, the first person I called to tell was Dr. Flavia. I'm like, by the way, you're going to be my doctor, just so you know. Like, you are my plan A and my plan Z. I did not have any other plan. It was you or you or you alone. And
Thank
it
you.
was one of the best decisions that I made for myself. And for me, one of the key considerations was that, number one, you are my friend. And so you
Mm-hmm.
kind of had an understanding of
Mm-hmm.
what I did and how I did things.
Mm-hmm.
And number two, I knew you would take care of me. I knew like I was in good hands. So this will bring us, I believe, to the
Mm-hmm.
next. Okay, no, this is not going to bring us the next one, but it's going to bring us to something that you said that really stood out for me and I've never forgotten. One of the things you told me was that everything that you have been doing until this time has prepared you for this moment of pregnancy. So do you want to start us off from there?
Okay. The thing with pregnancy is it's unpredictable. Let's be
Mm-hmm.
honest. Everyone has a very different experience. And we say I'll start it from before. If you're able to prepare for it, that's
Yes.
the best thing you can do. It may not be necessarily that I want to get pregnant tomorrow, but your lifestyle and the way you take care of yourself already sets you up. And that's what I meant, already sets you up for a better pregnancy in the sense of the exercise and taking care of yourself, taking care of your mental well-being. Because a lot of times we forget our well-being in terms it is physical, it's mental, it's emotional. There's so many things that are going on when you get pregnant.
Mm-hmm.
And we also were talking about in terms of the practitioner, and that's what I meant about before pregnancy, in the sense of you've been seeing someone, you've sort of a rapport with your healthcare provider, so that when you do get pregnant, you trust this person to take care of you. You trust that you can raise your issues in a consultation room and you'll be heard,
Mm-hmm.
that they will support you in your journey. Like it's a relationship. So sometimes many people think of your doctor as telling you what to do. It's not. You also know your body. You also know how your journey has been. So I always say that it's a relationship, as with anything, so that you're comfortable and it allows you to go through pregnancy really well.
Oh, and you've gone straight into, or rather, you've transitioned us straight into the next point of what to look for when you're choosing your healthcare provider. But I really just want to harp on and emphasize a little bit more on the preparation beforehand. We're always being told you need to eat right, you need to
Mm-hmm.
exercise, you need to find a way to manage your stress, you need to find a way to deal with your self-care. And these are important things. And like you said, you might not necessarily be planning on getting pregnant tomorrow. Like for myself, I got pregnant really randomly, if I'm being honest. But when you know that you have been almost preparing and priming your body such that a big event like a pregnancy does not necessarily destabilize you, and instead your practices kind of help carry you through. I think that would be the words I'm looking for, that your practices, what you're doing now, will help carry you through the pregnancy, and it might be a little bit easier or more bearable for you as you go along. And so the word here for choosing your healthcare provider, like you've ably said, is relationship. Do you have a relationship with your healthcare provider? And I'm grateful because we used to talk about the randomest of things, but now that I think about it in hindsight, I'm like, all those conversations, all
Mm-hmm.
that getting to know Brie and know Dr. Flavia, and all these kind of, again, transitioned us into a professional doctor-patient relationship that
Okay.
just happened to work. So
Yes.
do you want to talk, and this might be putting you on the spot a little bit, but do you want to talk about um, doctor-patient relationships with your friends?
Um, that's usually a very interesting dynamic because
Mm,
you sort of have to do a mind switch. That yes, I know it's Brie, but I also don't want a relationship to cloud my medical judgments and to treat you differently as I would a different patient. So first, I have to be sure and ask you that, are you comfortable with me as your doctor? Will you be open with me so that you don't hide something feeling like this may see you in a bad light? So I always want
mm,
my friends to be what is it called, very comfortable with me. I mean, in this time, I think I'm now getting used to it. initially it was a little tricky, but now I'm getting and I think also because your friend also knows you, it also balances out. You also feel safe.
Yes.
And I've also learned that when I'm also dealing with friends, if I have a query, I still consult. I think it's very important to still consult with my colleagues so that if I feel like I may be missing something, maybe I feel like I may not be seeing clearly, I always try to step away, think about it critically, talk to a colleague of mine just to see that I am not, I'm giving you the best care. And it's just, I guess I get a lot of feedback that I'm very calm. So I think and open. So I hope that that means that people can still trust me, can still come to me even as a friend.
I think the most important bit for me when we were journeying together through this was that I could call you and I could trust you. That was the most important thing. And I also remember that for me it was important because I had said, I know I use essential oils. And
Mm-hmm.
I did not want someone who would tell me, oh, you can't do this. I'm like,
Mm-hmm.
I'm an adult. I understand the risk. I'm obviously not going to do anything that would jeopardize my well-being. And if you say, okay, Brie, you need to slow down here, of course I will pay attention to you. But I think it was important for me to find somebody who would respect and not kind of agree, but who would
Yeah.
respect and understand why I wanted to use essential oils in my pregnancy journey. And I'm very grateful that you did not tell me I couldn't do it, because I know
And I
you
think,
also know that I was very particular about being careful with it. I'm not a careless person, especially when it comes to oil. So I would not intentionally put myself at risk. So like we're saying, some of the most important things are, relationship, obviously. How available are they knowledgeable, how supportive are they, and do you feel hard in the process? And I personally felt very hard. I used to actually enjoy our consultations, like
thank
always
you.
like a highlight, because I would come and I would ask you all these questions, and you would explain things systematically, and tell me this is what we're going to do. And the other thing I think I really loved was you came up with a plan. Like,
Mm-hmm.
you came up with a plan, a medical-ish plan, a plan that,
Mm-hmm.
this is what we need to do. And then I'd say, okay, this is what you want us to do, and this is where I'd like to fit in a couple of things that I'm going to do. So that was really, really cool. Just so you know, I think you're an amazing doctor. I'm
Thank you
just
so
saying.
much. And I
You're
usually
an
like
amazing.
that. Thank you. I usually like that on the first visit, I give
Mm,
someone an overview of what to expect. So
yes.
we discuss, I'll tell you the tests I think that are important. I'll tell you I give you a breakdown of what to expect. It may not be 100%, but at least you know what to expect in the first trimester, second, third trimester. What are the investigations that I think are important? And then towards the end, also discussing a birth plan. So I think that's important so that even as you start, someone has an idea of the flow. Then they're not caught off guard.
Mm.
You don't, and I tell you, oh my gosh, we need to do this, and I had not given you any warning.
I agree. So that also brings the point of, preparedness. That is your doctor organized and orderly? Because I don't think when you're going through pregnancy, you yourself are confused. So you don't want to have a healthcare provider who's just as confused or even more confused than you are. You want somebody who's calm. And now that we're talking about this, I can see why calmness would be a very important quality, because pregnant women tend to be, today I'm here, tomorrow I'm there. So you need somebody who's kind of like balanced and calm, and can help you synthesize the process without feeling overwhelmed. And it really helps that, yeah, you do have a calm countenance. So let's quickly go through, why should you use essential oils in pregnancy? For myself, like I said, it was a no-brainer. It was like, I've been using oils for all this time, so I just quickly transitioned my self-care routine around the essential oils that I really, really loved. But if you've been hearing my previous classes, one of the things I really talk about nowadays is my focus has shifted to an understanding that what really makes essential oil therapeutic are the chemical compounds that it contains. So and these have been scientifically studied. So there are what are they called? There's research to back up certain claims. And then the other thing is that using essential oils is an art. So once you understand that, for example, essential oils are relaxant for whatever their chemistry makes them relaxant, it becomes an art form where you decide, okay, so how do I want to use it in my everyday self-care to help me sleep, for example. So the main qualities that make essential oils suitable for pregnancy are that it's an effective and a non-toxic option to help support your wellness and self-care. So we know self-care is a must at all stages of your life. Pregnancy is no exception. And you want to use effective and non-toxic options. And it is more important to really consider toxicity, especially when you are pregnant. I mean, during all the times, but everything is heightened during pregnancy. So you have to take a bit more extra care. And so I'm going to issue a caveat over here and say that your essential oils must be pure and high quality oils. You can't go and get an adulterated oil and expect to receive the same effect, which is personally why I insist on using doTERRA. Then essential oils are aromatic, and most of them are emotionally uplifting, and they help reduce anxiety and reduce stress, and they're also very relaxing. Then they are antispasmodic, and which means they can help to soothe achy muscles. They are relaxant and soothing, may improve sleep, and they're adaptogenic. I think for me, one of the most amazing qualities of essential oils is that they're adaptogenic, and they help to bring balance in the body against physical and environmental and even sometimes chemical stressors. So if you're too hot somewhere and use an essential oil, it will kind of help cool you down. If you're too cool, it can help heat you up. And these are just a few. Like if I was to sit down and explain, I'd probably need an hour just to talk about some of these. So the questions are, how do you use essential oils in pregnancy? So it is better to use it topically. That means applying it on your skin, but you have to ensure proper dilution. There are dilution guides so that your skin doesn't have any reaction. And then aromatically, you can either smell directly from the bottle if you can stomach it, because many pregnant women again are averse to smell, or you can also just diffuse for a while and then come back in. And then internally, although I talk about this with a caveat again, number one, use it if you know what you're doing and if you're only using high quality oils. However, if this is a scary route for you and you're not sure of your oils, don't even think about it. It's never that serious. So some of the precautions you have to take are, the quality of the oil you use matters. You cannot use an adulterated oil and expect it to work. Don't overdo it. Less is more. It's better to have a streamlined kit. And these are, I don't know if you can see that, but these oils, 1, 2, 3, 4, 5, 6, 7, 8, for the entire duration of my pregnancy, I only used 8 oils. And that is regardless of the fact that I have over 100 bottles of essential oils. During pregnancy, I only stuck to a very core and streamlined kit. And then stick to diffusing and topical application as much as possible. And then, of course, use other wellness modalities to support you as needed. And please don't hesitate to see a doctor if necessary. Right. So we're going to talk about common pregnancy symptoms. And I'm going to allow you to do the medical bit, and then I'll come in after you to just talk about, quickly run people through essential oils that they can use to support them. So we're going to go in that order. Feel free to go all out and discuss the main points that you think would be necessary for people to pay attention to, right?
Okay.
All right.
Usually in the first trimester, yes, it starts with food aversions, may progress to nausea and vomiting. Some people may just have mild nausea, others progress to the point of vomiting. Then there are those who can't keep anything down, have weight loss, and what we call now hyperemesis, where you can't keep anything down, you're losing weight, it's affecting your functions, your liver, your kidney functions. So that is now what we call the extreme form of hyperemesis. And that's one of the commonest first trimester and may tell most people that they're pregnant when they start, like, why am I having food aversions and don't like certain smells, don't want to eat certain things. And then you can discuss some of the things that we can use during with nausea and vomiting.
Okay, so I'm just going to say like a quick story here. Do you know that I never had any nausea, actually. I think I had it twice.
And it was no vomiting? You really had a good
Nothing.
pregnancy. You had a really, really good pregnancy.
God was gracious. Like
Mm-hmm.
nothing. The in
Mm-hmm.
fact, what I remember distinctly was that one day I woke up, I smelled milk, I refused it, and I
Mm-hmm.
started drinking uji. Okay, I should have been
Mm-hmm.
alerted that something was up, but I was like, I was like, this is very strange. Why?
Mm-hmm.
Like I smelled, and I remember it was Brookside. I was like, yuck, this thing smells so bad, and
Mm-hmm.
it just went. Um,
Refused.
it
Uh-huh.
refused. So that was the first time I didn't have any nausea, but I
Uh-huh.
remember two occasions when I felt like throwing up. So I thought, my stomach is bloated. And then what happened in the second trimester, I switched to craving chevda and mango
Mhm.
flavored lollipop.
Mango flavored
And
lollipop. Is that? I
yes,
didn't even know there was mango flavored lollipops.
at the time there was, and I couldn't get enough. So every time I went out, I would just be licking mango. It had to be mango, and it had to be a brand called Pin Pop. It had like no, and it was
How did you
tropical
even
heat.
find it? Uh-huh.
It used to be at the matatu stage. You could only
Mm-hmm.
find it there. So when
Mm-hmm.
I'd buy like 10.
Wow.
I'd buy like 10 just to make sure I had that. And then I remember there's also chevda, tropical heat
Mm-hmm.
chevda. And then the third trimester, I would crave butter and ice cream. That was it.
Ice cream, yes,
So
butter. Interesting.
that was not third trimester, but it used to fascinate everyone because I'm like, I just want chevda. Just go and buy for me chevda.
Was it the
But
chili that
maybe
you were craving?
I have no idea. I
Mm-hmm.
honestly cannot even tell you. But one of the best and gentlest options for nausea and cravings are citrus oils, and my absolute favorite is grapefruit. And so many pregnant women can manage grapefruit because it's a sweet smell. And like lemon, which is sour, or lime, which is sour, grapefruit is just a very good oil. It's gentle and it smells sweet. So what you would do is you could either take a drop and rub it on your abdomen or the bottoms of your feet, or if you can stomach it, you can actually just quickly inhale from the bottle. And many people find that as you do that, you kind of get relief almost immediately. The other things that you can do are to take peppermint in a glass of water, only if you can manage it. Some people can't, because peppermint is a little bit strong. And then sometimes you would diffuse your room the night before, because nausea mostly happens in the morning, right?
Yes.
For many
And
people.
for many people, and just a disclaimer as well, many people think that sometimes the nausea will end only at the end of the first trimester. But there are
Mm,
certain ladies who end up having it throughout the pregnancy. The peak is usually at around 8 to 10 weeks. That's usually
yeah.
the peak. And then now it starts going down. Then at about 12 to 14 weeks, most people, the nausea has resolved. But there's still a percentage that continue on to the end.
Oh wow. Okay.
Mm-hmm.
So
Mm-hmm.
with that information, then you and you know that this is the beauty of using essential oils. Sometimes once you've used oils for a couple of times, you begin to understand what you're drawn to. And so even this list of suggestions is just that, suggestions, because you might find that if you smell peppermint today, it works, you like it. Tomorrow you're like, I don't even want to see it. The next day you say, okay, let me try peppermint. And for some people it can be something as random as patchouli. So sometimes, again, also using essential oils is really working with your body and working with the space and the season you're in, because there's no wrong or right answer. Okay, except with some exceptions, of course. But if you take patchouli and it works today, tomorrow you try grapefruit and it works sometime. But again, with pregnancy, you don't have the luxury of trial and error. The other thing you can do is to take a tissue, fold it, and just keep it in your pocket. When you feel the urge to throw up, for example, come, you kind of inhale it. Just the same way people who are car sick, you normally have peppermint around. That's why they normally chew tropical mints to kind of help ease the discomfort caused by vomiting and stuff like that. So those are some suggestions. Cardamom is also a very good oil to have, but it's a spice oil, so not many people may be able to manage that. Okay, so let's talk about insomnia. Wow.
Yeah. Insomnia is another one and could be due to different causes. The first,
Mm,
initially, just be a lot of that some women who have, because of the progesterone effect, very sleepy, very sluggish, especially in the beginning. So that does happen, and then it may switch as the pregnancy goes along to insomnia. The insomnia could be many woken up by hunger, discomfort of the pregnancy itself in terms of finding a position to sleep, because we usually recommend to sleep on the left, but sometimes it's very difficult and people have been, so we still say left is the best. You can still turn to your right, but you find that positioning of the pregnant woman, it becomes difficult to sleep. Other women, as the pregnancy gets bigger, also have difficulty in breathing because they just feel like it's too full. So all these discomforts make insomnia a very common symptom during pregnancy.
Oh wow. Yeah, I remember what happened for me. At the beginning I used to sleep in the afternoon. I would sleep for 3 hours straight, and then I would still sleep at night. So we'd ask ourselves, what exactly is going on? So as a full disclaimer, I actually knew I was pregnant 4 months in. That's another story. So like I was not, I was not aware of all these things. I just used to think, I'm like, yeah, I'm sleepy. Like I sleep 3 hours from, I've just woken up at say 8, and then I'm back to sleep at 9 until 3. No, at midday till 3, and then I will still sleep at night. It's only later that I came to realize, progesterone, yeah, does some things. And then as the pregnancy progressed, I was okay second trimester, but the third trimester, sleep refused. I'd wake up at 1. I'd wake up at 1 like clockwork, and I couldn't sleep. I couldn't sleep for like 2 to 3 hours. So I figured, okay, let's wash the dishes, let's read, let's journal. Instead of fighting it, I stopped fighting. But
Would you be able to sleep in the morning, like as the sun came up?
no, I would sleep until I believe it used to be 7. I would wake up pretty early. I'd go back to sleep at 3, then wake up pretty early, then probably have. But I know I napped a lot during the pregnancy, all through. I think I would have a minimum 2 hour afternoon nap.
Okay.
Minimum. It was standard. But one of the oils, or two of the oils that just really, really helped, were lavender and the balance blend. And balance blend in particular, because let me just read out what it has. It has spruce, it has whole wood, it has frankincense, blue tansy, blue chamomile, or osmanthus. So it's a mix of florals, and it's a mix of resin, and these oils in particular just work together to help create a relaxing environment. So what I would do, one of the ways to really improve on your sleep hygiene, not just as a pregnant person, is to have a relaxing bath, so that in as much as by the time you're going to sleep, your body is really winding down and your thoughts are winding down, so you're not always on the move or always running about here and there. So these two in particular were just well, what really helped. And I think pregnant women want to pay attention to their environment in as much as you can help it, to make your environment as comfortable and as nurturing as possible, to encourage you to have some bit of sleep. But if you find that you can't sleep, find something to do in that time and then try and make up for the sleep. So is there a danger of not sleeping enough during pregnancy?
Yes, you get the chronic fatigue, and you can imagine day in, day out having lack of sleep for any human being, let alone when you're pregnant, when you have so many demands. And remember,
Yeah.
we always say a lot of recovery happens at night when you're asleep,
Yes.
in terms of your cells recovering, in terms of your brain, in terms of even the neural connections that happen at night. So for anyone, and least of all a pregnant woman, you really have to take care and find, as you said, a system that works. And as you're saying, a relaxing bath, no screen time towards bedtime, not switching on your TV, getting into bed immediately and having the room a little bit cool. And as you said, things like that to diffuse in the night as you fall asleep. Like just those basic, they may seem simple, but as a routine that you do before bed helps you to get the maximum you can from your night.
And I guess also, like you're saying, in pregnancy, the key here is maximize, get the most out of your night as much as you possibly can. And next month, we're going to be doing a class on sleep hygiene. I'm so excited because I'm going to be having a sleep expert actually come to talk with us. So that should be interesting. Okay, so the other one now is talking about pains and aches. Yeah. Mm.
This is a very, very common complaint, and it's different for different people. But the
Mm-hmm.
commonest pains and aches start around the pelvic joint. So patients will start talking about hip pain, the
Mm-hmm.
pubic symphysis pain, the lower back pain, sometimes even the limb pain, because a few women get all the way from pain into muscle cramps and muscle pulls. There's also a lot of discomfort in the tummy as the tummy is expanding. You can imagine the skin is stretching, and that causes discomfort, tummy discomfort. So there's a lot of pain in aches. A lot of women talk about pain and what is it called, at the lower rib region, especially as the pregnancy is big. So
Mm-hmm.
there's a lot of discomfort during pregnancy. Your body is completely adapting for this new human, but the commonest is the pubic symphysis pain. A lot of women get the round ligament pain, and then as your back tries to accommodate the fetus, it changes the curvature of the back, and then you start seeing women waddling
Oh yeah,
towards the end. Yes.
looking like
Most
a
of the
jacket and so
time.
cute. Yeah,
So
jacket.
all that is part and parcel of pregnancy. But we also notice that a lot of women who um, do a bit of exercise and stretches and yoga tend to do better in terms of the pain. It really tends to relieve a lot of their discomfort. So that would be something to put at the back of the mind of someone who's pregnant, even as you
Mm.
discussed.
One of the things I know that people say was that walking would really help. Squatting. I know
Mm-hmm.
I did a lot of squatting, and they were saying that it was like a way of helping just to prepare your body, get it in optimum positioning for the baby to come. The other thing I know I did a lot was I would roll deep blue. This deep blue is like the, what do they call it? They call it the soothing blend. It functions almost like deep heat. So what I would do was I would make a roller bottle. I would put like 10 drops in a roller bottle, and then dilute it with coconut oil, and then just roll it. And I would walk with this in my purse. I would walk with this in my hand. So anytime I felt a pain coming on, and I remember for me the pain was mostly on my lower back and
Mm-hmm.
towards the third trimester when I became a lot more heavier. But I know
Mm-hmm.
we I used to do yoga back then, and then we would also take long walks. What do you think about massaging to help soothe pains and aches?
Because it's the same concept when we talk about, like, even during physiotherapy and things like that, where they also do the warm packs. So yes, it also just has to be done in a safe environment. There are those who do it at home, where your
Mm,
partner or someone in your house can help you with the lower back massage, applying like a warm compress, something warm. People do the hot water bottle and cover it just to allow soothing of those muscles, because there's also a lot
yeah.
of muscle tension, just to relax the muscles. So it's dependent on the location, the lower back, but it's always just safety and not overly massive. But I think it has a role.
Did I do it? I think I went for a massage, I think once or twice. Because the actual other thing is, sometimes the way you'd feel stiff. I
Mm-hmm.
also used to feel a lot of stiffness. So going for a massage to kind of just extend and relax was also very helpful. So for me, Deep Blue was one of those oils that, and for the people who have been pregnant and have reached out for help, Deep Blue is one of the oils that I put in because it's really good to go and just soothe. It has peppermint and it has osmanthus and lutanzi, and all these oils just work together to help your body relax and to help your muscles just calm down, right? Um, the next thing we're going to talk about is skincare in pregnancy.
Um, there's so many changes as well that happen with it, and it's hormones. So you'll start with, a
Mm,
lot of women have darkening of the skin, and that's due to an increase in the melanocyte stimulating hormone. So there are those women who have the line at the tummy, the linea alba, and there's a darkening. So a lot of women, you'll see their skin color changes, and it's very distressing for a lot of women. Some
it is.
women get a lot of acne. And then we haven't even talked about the stretch marks, because then that's a thing that starts. And it usually starts by feeling like you want to itch, and by the time you're feeling that way, we are already heading towards formation of stretch marks. And many people think it's just stretch marks over the tummy, but the stretch marks can occur in anything that is expanding. So you find your breasts are getting bigger, so you'll find stretch marks on your breasts, the hips as well, because of the weight you're gaining and the change. So stretch marks is just not on the tummy, it can happen on your hip, it can happen on your breast, anywhere that you're gaining weight and the skin is stretching. And that's also another very distressing thing that happens during pregnancy.
And I wasn't particularly aware of that one, of like anywhere where your skin can stretch, you can get a stretch mark. And also that when you start feeling like you're itchy, it shows that stretch marks. But I've also had, there's a certain type of itch that comes at is it 38 weeks or something, a puppy
And
something something.
and and the trick is, don't itch. Seems easier said than done, but don't itch, because the minute you start itching, it's almost like a process. And I think maybe you'll talk about this in the sense of it's recommended, if you're going to apply any oils on your skin, you need to start it from the very beginning
Yes.
before your tummy has stretched, because people think, yes, now I'm 20 weeks, my tummy has bulged, that's when I start applying. You're supposed to apply throughout from the very beginning, even before your skin has started to stretch. Then you have a good chance. There's still some who still get the stretch marks, but it may not be as bad.
And I agree with you that I think, especially when it comes to skincare, what you want to do is to, as much as you can, prevention, rather than trying to cure effects later, to start by preventing. And the cocktail, the synergy of oils that I found that really worked was frankincense, helichrysum, and lavender. So helichrysum and lavender are floral oils, and then frankincense is a resin. So what these do in particular is that they're very regenerative for the skin. And how you would use it is, just get your whatever oil you're using. So if you're using a lotion, for example, and just kind of drop in say 5 drops of each, and then mix that together and keep massaging yourself faithfully. Don't miss a day, and keep doing it. So the oils are going to just help regenerate your skin and help keep your skin a little bit more supple. And what did I really want to say about this one in particular? So you just have to be intentional and conscious about doing this on a regular basis. And of course, don't hesitate to go and see a dermatologist if you feel like things are getting out of hand, especially with more serious conditions like acne and scarring and all that. Because yes, there are women who glow during pregnancy, whose skin glows, but then there are others on the extreme side also whose skin just goes on another tangent. And you might need the help of a dermatologist here to kind of help you figure out how to get this under control. But as a way of, just skincare, self-care, adding frankincense and helichrysum and lavender does make a noticeable difference in the long run, right? Oh,
Yes,
wow. Okay.
and to make
Mm-hmm.
it like a self-care routine where you start with a nice bath and then now
Yes.
apply the oil, so that it doesn't become like I'm preventing stretch marks, but it's just that I'm taking care of my skin, so that the perspective of how you're doing it changes.
Oh, and that's a very good point. We really do have to consider perspective. How we do the thing. If you're looking at it as a chore, as a burden, instead of looking at it as, I'm nurturing myself. As I'm nurturing a baby, I'm also nurturing myself during my pregnancy, so that it can also be an enjoyable, as much as of an enjoyable experience for you as well. Oh,
Yes.
even as you are embracing the changes that are coming. Okay, let's talk about exercise and movement.
So we always start with a disclaimer. So if you need to seek medical care, and that's why you're seeing your practitioner, because there are certain people where would say exercise and movement would be limited. But to begin with, you really start as well as, if you are working out before and you are exercising, it's okay to continue during pregnancy. It's just a disclaimer on maybe the kind of exercise you can do once you're pregnant. If you weren't exercising before, I think it's a good thing to start, but you would start slowly. And as you talked about, you do a lot of walking. If you are a swimmer, you can swim. So again, you take it easy. You can't come from no exercise to trying to do something very strenuous once you're pregnant. Exercise and movement is really good. It helps you in, uh, first of all, you're out in the open, you're exercising, so already you're endorphin, so it also helps you in terms of lifting of the mood. Physically, it helps you so that you're also not gaining so much weight. Pregnancy comes with weight gain. It's almost inevitable for most people. The average is about 9 to 12 kilos. It can be less and can be more, and also depends on your BMI when you start. So someone who has a higher BMI doesn't have as much room to gain because it comes with its own risks. So the exercise and movement also help you burn calories. Then you then find that you're not gaining as much weight as if you were not exercising. We also use exercise and movement even as part of management of, for example, someone who has gestational diabetes. We recommend that movement after feeding as well, just to burn the food that they have eaten, and that helps to maintain their sugar. Exercise and movement is also very good for your, as you said, the way you do squats and lunges. Those kind of things are very helpful towards the end in terms of delivery, in terms of your pelvic area. Um, Exercise and movement, what else? Also can really help you with sleep, because I think if you're also having a lot of exercise and movement, it sort of tires you out and may allow you, after a bit of movement, showering and having a nice bath, eating well, and then going to have to sleep, you'll be able to sleep even better. What else can I say about exercise? So it's not that it is not allowed. I think it's just to discuss with your doctor in terms of how far you can go. There's certain conditions during pregnancy that will tell you movement and exercise would be risky. And for example, this is a patient, for example, who's bleeding in pregnancy. If it's early pregnancy, it could be a threatened miscarriage. So that's a patient we would not want to do a lot of exercise and movement, because that could lead to the miscarriage. Or, for example, later on in the pregnancy, you can have something called placenta previa, and that's a placenta that's covering your cervix. So you'd be at high risk of bleeding. So that's also a patient who would say exercise and movement would be limited. So that's why it's important to also discuss these things on your first visit or pre pregnancy with your doctor, so that then you have a plan in terms of what can I do, what can't I do, should I be lifting very heavy weights, is that good for me? Like, those are the discussions you have. And even as you attempt to do them, also listen to your body. Your body tells something is not right. If you go and try and do this class and you're in so much pain, discomfort, and you don't feel well, then that may be a sign that perhaps you need to slow it down or change what you're doing. Yoga is also quite good in pregnancy, but it still need to have a guide of someone who's very conversant with pregnancy as your guide during pregnancy.
And I think all those are very important points. I love that you're saying, check with your healthcare practitioner first, because we tend to want to be ninjas, and you tend to want to push yourself even when your body is just saying, what, slow down and take it easy. And one of the greatest lessons I learned, because back then I was a very fit and active yogi, was you have to give your body space. If your body needs to rest, you need to allow your body to rest. Don't push yourself because you're trying to satisfy like an exercise goal or something. And I remember when you put me on bed rest for 2 weeks, oh, that was hard. But it was also such a relief. I mean, it was also such a relief to be able to just, we're not doing anything. Let's just take it easy. So, what I did do some prenatal yoga flows. I remember I did squats, and I remember we took a lot of walks. We would take out 30-minute walks around the neighborhood, and that was very useful, especially towards the third trimester. And then the oils that I used were technically I used deep blue, anything exercise related, just to kind of help the muscles. And then I would also roll on myself past tense, which was just really for tension and to help the body relax. I didn't put a picture of that blend there, but it was also one of those ones that really helped. And I would just encourage everybody who's pregnant, just get into exercise, get into a habit of kind of moving, even if all you can do is 15 minutes of walking around the block. Don't be sedentary and stationary. You want to keep your blood pumping and flowing, lest what actually causes varicose veins? And this is just a random question.
It's because of the pregnant uterus. So the pregnant uterus, as it gets bigger,
Yeah.
interferes with blood flow that's coming from your lower limbs. So that will cause now the vessels to dilate. That's how you also get a risk of deep venous thrombosis as well for your deeper veins. And then even as you come up, it's the same thing that causes hemorrhoids. So all that is a
Mm.
concept of blood flow because of the pregnant uterus that's interfering with the blood flow coming from the lower limbs.
And is it factually correct to say that exercise and movement will help in the circulation of blood around your body?
It is, and that's why, like for example, already, let me give an example of like deep venous thrombosis. That's like a clot.
Mm.
Is pregnancy already makes you at high risk, but also sedentary, not moving as well, also makes it at high risk. So those are one of the risks, like stasis, like blood is not flowing as it should. So movement is good for you in terms of also that, in terms of formation of clots and all that, all those issues.
Oh, that's a good thing to
Mm-hmm.
know. Back to walking.
Mm-hmm.
Everybody needs to keep walking. Okay,
And a
so
trick
oh yeah, now sorry.
before we move to that, you were talking about like after meal. So we usually have a nice way of making it like a routine or a system is to try and do maybe 15 minutes after you eat. So you can have your
Mm.
meal and then after, and then just have a small walk for about 15 minutes after your meal. So that way it sort of triggers you to have like a routine and movement. Like I have my meal and then I walk. I have my meal and then I walk.
Oh, I love what now that you've talked about, having a routine. One thing I've really picked up from this whole conversation is you can turn your everyday moments into moments of self-care even during pregnancy. So as you're
Mhm.
talking about meals, when you prepare meals that are enjoyable for you, and this is just off the cuff and just based on
Mhm.
what you're talking about, preparing nice and nourishing meals for yourself as an act of pregnancy self-care, and then taking a walk after your meal to kind of, and you get in your exercise and your movement, and also taking some time to just relax and calm down, and then
Mhm.
have a relaxing bath, diffuse before you go to
Mhm.
bed. Your bed has comfortable say sheets, and it's nice and dark and cool, and that way you have already, I believe, with such a simple routine in place
Mhm.
based on things you do every day, because you must sleep, you must eat, you must
Mhm.
take a bath, just
Mhm.
based on everyday activities that you're doing, you've already created for yourself a nurturing self-care routine even while in pregnancy.
Then it doesn't become a task.
It doesn't become a task, and it makes your life a lot more, it makes your life much easier. Oh, that's so good. That's really good. So do you want to talk about mood and stress now?
Um, Mood and stress with pregnancy is multiple things. It's the
Mm,
hormonal changes that are occurring during the pregnancy. You find your progesterone, as you know, progesterone tends to be like a mood, it's a downer. Is that the word? A downer. So it has a profound effect on your mood. You may find yourself very quick to cry, very quick to react. You may find yourself emotional. And it's hormonal changes. And then you can imagine also there's a stress. Yes, you're pregnant, depending on the circumstances in which you got pregnant, depending on how your life situation is at that time. You may be having other children, and there's so many demands on you. You can imagine you're still having nausea and vomiting, maybe a working mom, and you have to go to work. So you can imagine your body is changing, hormonal changes in your body, which are trying, and then your body is trying to accommodate the human, and your life must still go on.
yeah.
So there's so much on your plate on any given time. You're unable to eat. You may be having nausea and vomiting. You can imagine you had insomnia. Your pelvis is aching, and you have to sit on an office chair the whole day. Um, it's There needs to be so much. I don't know if the word is grace and a lot of support in terms of your spaces that is at work and at home to help you be able to manage all the things that are happening. And if it even requires seeking out psychological help, there's so much that you can support yourself with during the pregnancy. As I think there's a societal thing that you must be, as you said, a ninja. Like you
Mm,
should be able to take this. It's an amazing experience. You should be very happy to be pregnant. But there are realities of life that are happening in your life that make this a stressful situation. And I think the support around would be very helpful for anyone who's pregnant. Okay, pregnant and unpregnant, but especially when you're pregnant.
no, I agree with you, and when I'm hearing you describe all these things, I'm like, oh my god, like, yeah, pregnant women really go, especially if you're multitasking as a mom to other children, and if you're working, and like, oh wow, you've said it like that, and I felt so much pressure. I'm like, and you're right, we need to consider how our support systems are going to help us. But if you don't have that kind of support, what do you do? And that's a whole other conversation. But wow, it is an important, I think many people underestimate the mental effect of pregnancy, like the mental and emotional, I'm not going to call it a burden, but the mental and emotional implications of being pregnant, especially when you have a whole load of other commitments around you. So if you're able to, one of the things I would suggest that pregnant women do a lot is journal, or talk to someone, or find a mom whom you can talk to, find a support group. Wow. Oh, I when I really, I'm even so speechless, because I felt the weight. I really felt the weight on this particular segment. Like, I've wow. I guess, let me speak for myself. At the time, I guess my circumstances were different. Even though I was a new mom, and I was going to be a new mom, and I had a but at every stage of pregnancy, whether you're a new mom, or this is your second child, or your third child, or your fourth child, there's always some mental implication of pregnancy. So we just have to find ways to really support. If you can pray, you pray for strength, and you pray for grace. Don't be afraid to ask for help. Don't be afraid to take leave if it is an available option for you. In terms of oils, the balance blend was really helpful, as well as citrus oils, and also to help with the emotional upheavals. Here, today you're up, here tomorrow you're like really down in the dumps. So citrus oils were really, really good. Wow. I feel like I need a moment to just recover from the gravity of some of those realities. Right?
And finding that there's no time and space to have an outlet for it, because you have to keep moving. There's always something going on, and we'll talk about that later. But you can imagine that goes into postpartum, where the human was in your tummy, and now the human is out of your
In your
tummy with
face.
demands and needs, and it's almost. I think most of the feedback I get is that it takes almost from the time you're pregnant to 2 years to sort of, when your baby is about 2 is when you start sort of coming back to yourself.
Yeah. Yes, yes. Oh, wow. What? Oh, okay. All right. So we're going to touch on that bit a little bit later. Let's talk about the supplementation.
Okay. For supplementation, I will start by, and that's how the preconception care is an important thing. Preconception is care before you're pregnant, and usually recommended and I'll start with the preconception clinic and care, and that includes starting with your preconception supplements. Most commonly, we start with folic acid. Folic acid is one of the most important supplement that a pregnant woman can take, and its purpose is to prevent some of the like abnormal defects, for example, neural tube defects, and that is something that's recommended to be taken from at least 3 months before pregnancy, if you've had a chance and you're planning and it's something that is in your plan. So folic, and if you notice, a lot of the general supplements, especially tailored to women, have folic acid.
Oh,
And
okay.
I'll still touch a bit on the preconception care and its importance. The other thing we do in that care is to, in case you have any chronic illnesses, just to ensure that you're on the right medication, that if you're pregnant, that you're safe. And yes, okay, so that's one. So folic is one of the most important supplements. Another really important one is iron. And you find a lot of ladies, because we're generally menstruating, and depending on your flow and how we eat, we generally do not have as high blood level as gentlemen do. So that's one of the things that tends to be on the lower end for many women. And you can imagine, again, during pregnancy and its demands. So
Mm.
iron and folic tend to be really important supplements. Even from health center level, even at a public facility, that's usually one of the most basic supplements they give everyone: iron and folic.
And folic
There are
acid.
iron and folic acid. The other supplements, there are all those small micronutrients that we find in other things. Another very important one is calcium and vitamin D, as we find also the demands. We also don't get enough of the calcium from our diet, and the demands also increase during pregnancy, and that may present as muscle cramps, muscle pulls, and that teeth ache, losing of teeth, and all that is just related to your calcium, because the baby also has demands, and so
Mm.
takes from you. So calcium is also another important supplement. Vitamin D as well. For as much as we're in a tropical country, we really don't sit out in the sun. We don't take walks in the sun. We're always in transit, in a building, in a car. So we never really get enough vitamin D. So generally, so almost as a basic, we tend to do that: iron, folic, calcium, and vitamin D. There are very many other things, and depending on your demands, that are important. But I just wanted to touch base on sort of the
The key
important and
one.
the key ones, and especially the iron and the folic.
Oh wow. And so what about diet? Can you just say like I'm going to try and maximize my diet so that I don't need to take supplements? How is that
It,
even a feasible?
some, in reality, there are a lot of places like abroad where their food is fortified. So you then know that your food is already fortified and what you're consuming is already fortified with the things that you need. Our challenge here is, if you're talking about pregnancy and saying that you're going to use your diet, then you sort of have to demonstrate a food diary. It's not just eating skuma every day. It's, are you eating
Mm,
different kinds of vegetables? Are you not overcooking the vegetables? Because also we can say we are eating it, but you're eating the same greens that are overcooked. So how much folic are you getting? How
nutrient.
much iron are you getting from that? So
Mm.
it's a demonstration of, are you eating different kinds of vegetables? Are you mixing it up? Are you having red meat? So it's not that it is possible, but it will require such discipline, a lot of discipline and a lot of planning. And I can't say it's not possible. I think it is, depending on whether you can demonstrate and be very conscious and know what you're eating and having varieties and doing different food groups. It could be possible. But sometimes then your body tells you, you'll do the test and say, okay, your blood level is low, that despite your diet, you're not getting enough. Then I'll tell you, okay, we need to try and do at least the iron and folic. So also your blood values will tell us whether you're okay or not. If you're getting muscle pulls, muscle cramps, I'll tell you, okay, then your calcium is not. Your body also tells you, you start craving stones, you start doing all sorts of things, and your body will tell you that you're not optimum.
Oh wow. Okay.
Mm-hmm.
That's a very interesting point. Okay, yes, that your body will tell you that your levels are not optimum. So your cravings are actually like a language.
Mm-hmm.
Oh
Exactly. You're
wow.
creating a language. If you tell me, every time I smell it's raining, I want to buy stones, I want to buy, I'm excessively fatigued. There's fatigue that's related, even the symptoms that you come with, my heart is beating a little fast, I'll tell you, okay, let's check your blood level. So your body also communicates to you that
Not right.
something is not right, and then now we work around that, because there are women who come to clinic and say they don't want to take supplements, they have nausea, it makes them feel sick. Then we say, okay, then work on the diet and be very keen about it, but it gets to a point where you're now unwell, and then we tell you, okay, then let's find a supplement that works for you.
Okay, that's very good to know. Wow, and for me, what I did, and I remember telling you was like, Flavia, Dr. Flavia, doTERRA has some supplementation which I think were very useful, and I'll just quickly highlight them. So
think Priya's lost connection is lost. Let's see if I can try and get her online.
Okay, present slide.
Oh, okay, we're back.
All right. Oh, we're back. And I apologize for that intermission. Technology happens. But wow. Okay. So we were just quickly speaking about the doTERRA supplements. They have XC Omega, which contains your essential fatty acids, and then it also has antioxidant-rich essential oils. We had the Microplex VMZ, which contains 22 bioavailable vitamins and minerals and elements in proportions that will work with your diet. And then we had the Alpha CRS, which is a cellular renewal system, and this is the one that just has all these good things to help with metabolic process. But I think the most important one of them all for me was the Microplex BMZ, because it just had all the trace elements and the trace minerals that we needed for optimum well-being. Okay, so we've had that we need, folic acid, we need iron, we need to pay attention to calcium, and we also need to pay attention to vitamin D as the four main minerals that we need to kind of supplement, just to make sure that things are okay, not just for ourselves but also for the babies that we are carrying, right? All right, so let's talk about preparing for labor.
In terms of labor, it starts with a birth plan. Okay, of course, taking the pregnancy, all the things we've talked about, the exercise, the movement, your general well-being, is it physically, emotionally, all that has a bearing. But now, as we get into the third trimester, we start preparing for labor. And I'll put the disclaimer in terms of the birth plan. Sometimes the birth plan ends up being a CS from the very beginning. There are those women who may not qualify for the process of labor, and that discussion is hard. So we would have a discussion and say, okay, you proceed, and our plan for you is to have a normal, hopefully have a normal birth. There are those who maybe they've had a previous delivery or have other complications that may lead to having a cesarean delivery. Even that decision is made at around that time. And in terms of the other preparation for labor is, especially for a first-time mom, to start having a discussion of what to expect. It's never the same for everyone, but just to start by, how do you know it's labor? What will tell you that this is labor, in terms of explaining how contractions, because you may find, maybe not to compare it to cramps, but it's the contraction coming and going, being radiated to the back. So trying to have an explanation of what that will feel like, because you don't have an experience of that. Explaining about things like the mucus plug and how that looks like. Explaining about water breaking, because everyone assumes that you'll start with pain and then have water breaking. So you'd have, okay, what does that mean when I say my I'm draining amniotic fluid? What does that mean? So it's first of all explaining to the mother what labor is, and that can still be different for different people. Another preparation for labor is plan in terms of which hospital are you going to deliver in. Does this hospital support your needs? Have you had a look at it and you're comfortable with it? Having a discussion with your doctor in terms of who will be with you at the point of delivery. Another point in terms of preparation for labor is also having a discussion of what kind of interventions do we do during the process. And here we're talking about, there are some women where they would need to be induced in terms of their cervix is not opening and we may need to give them medication to open their cervix. There are women where we may need to release the water ourselves and may not be like a spontaneous release of water. Also having a discussion in terms of when do we know that things have gone wrong? When do we know that it's now no longer safe to continue with a normal birth either for you or for the baby? And in some of the things that we look at is how is the heart rate of the baby behaving during labor? How is the water when it breaks? How are your contractions? Are you opening up at the rate at which we expect? It's different when it's your first time or when it is you've had multiple pregnancies. There are those who have faster labors and delivery, others have slower. So those are the things we talk about in terms of preparation. Preparation is the same thing we're talking about the exercises in terms of the pelvic exercises. We also talk about perineal massages, which help especially for first-time moms at the point of pushing. What else have I forgotten? So there's a lot of preparation, and that conversation needs to start as early as possible, just to prepare your patient for what to expect. When do we say things have gone wrong? When do we say, okay, let's continue with the labor process? And even what to expect at the delivery room. Does every mother need to have a cut during the point of pushing? What kind of injuries can you get? How do we manage it? So it's a very long discussion that may not be had in one sitting. And that's why we say it should be a slow and continuous conversation, especially as we get into the third trimester. But by the time we're getting to the point of labor and delivery, your client is open. There are also the mass classes, which a lot of ladies go for, and also that allows them to prepare for birth, labor and delivery. Is there anything else I missed? Anything that you experienced that?
What did I experience? I think I what happened? I remember my son came a bit earlier than his expected due date, and it was just a good. And I understand it was a good thing that we had a conversation around, where you're going to birth,
Mm-hmm.
what's going to happen, what are the modalities, because I remember I had done the hospital visits, but I wasn't convinced, and then I was like, okay, I live quite far, I need to have a near option just in case. And then I remember the day of labor, I'm calling you at 5, I'm like, I think my mucus plug has just come out. It was so funny. And he was so hilarious. I'd spent the whole night walking around. Then I had downloaded an app. So I kept on measuring. I'm like, okay, I feel like something. I feel like a high, then I feel a pause, and I feel like a high. Okay, high meaning like I feel like a stretch, a contraction. Then I feel like a calmness. Then I time myself. Then the app is telling me it looks like you are in, what do they say, active? Was it
Okay.
light labor? And then active.
Latent.
And I'm like, what? Because I couldn't sleep. It was Thursday night. I could not sleep. I'd watched a certain program. When it's time to go to sleep, I just can't sleep. I'm waking up, I'm pacing, I'm pacing. I'm like, you guy. After 1 hour, 2, 3, 4, 5. I can't sleep. I could only sleep when believe it or not, I could only get relief when I would sit on the toilet. Like I had to literally go and sit. The lid is down. I'm sitting on it. That's the only time I would feel relief. Then I'm looking at this app, is telling me labor. I'm like, you're kidding. Then 5 o'clock in the morning, I'm like, I think my mucus plug has just come out. It was so funny. But it helped to have this conversation because I didn't know what to expect. So
Because you
having
wouldn't
had
have thought that was labor, because your pain was
no.
also very intense. So it could have been, oh, okay, I'm just having discomfort. Oh, okay.
Yeah, I would never have put it. So you're right, the moms need to have this conversation so that even if you can't quite understand the feeling, you have an idea. So you start asking yourself, oh, you mean this is actually possible, that this is what is going on. So perineal massage, I used helichrysum and frankincense again. and then resting, a bath plan, and a postpartum plan. Drinking some raspberry tea, because raspberry tea is very supportive for feminine health and especially during pregnancy. And then doing a massage roller. So during actual labor, I had a roller with frankincense and clary sage. It was just really helpful in the labor room. In the actual labor, every time I'd feel a pain, I'd clasp my sister's hand like this and then say, massage. And then she'd do, and then it would pass, and then we'd walk, and then she'd come again. And I'm like, it was really hilarious. But yeah,
I see
again,
something
yeah,
else. Sorry to
sorry.
interrupt you. About the postpartum plan as well, because I
Yes.
think a lot of obstetricians, which I think is fair because we're dealing with the lady, we don't think too much about the postpartum plan. We think about it to a point, but probably it
Not
would be good to start having those conversations as well, even as the pediatrician takes over in terms of the baby, in terms of the breastfeeding, and the support that's required during that time, because that's also another tough period. I think we'll talk about it a little later.
yes.
Mm-hmm.
But it's also good. It's just a good thing for moms to kind of have that,
Mm-hmm.
because you think work is to give birth, only to realize the real work begins after you have given the work,
Mm-hmm.
you've given birth. And like you said, it takes people up to 2 years. Some people recover much longer. It really takes time for you to get back into a frame of. It's not like it's a switch that you can just turn on and off and say, yeah, boom boom. No, it doesn't quite work like that.
And
Okay,
especially in terms,
so
yeah, sorry, in terms of breast care. Oh, okay, we're
mm,
going to postpartum support. Okay, I think that's
you're going to postpartum, but
yeah.
please take that one, and then I'll do this a bit later.
No, no, it's okay. It's just a continuation of that in terms of breast care and that expectation. Because there are the ladies who have the flat nipples who need a bit of preparation for breastfeeding, and all the trouble, not troubles, I don't want to call it troubles, and all the some of the difficulties that come with breastfeeding in terms of the time it takes for your child to understand latching. Another thing that's important is how to take care of the nipples so that they don't crack. Because also, you can imagine you have cracked nipples, your baby has demands, and breastfeeding. It becomes such a torturous situation. You find moms crying, they're overwhelmed, they haven't slept, the baby is crying, and then the nipples are cracked, and it's painful to breastfeed. So that we give information about that in terms of how the baby should latch so that they don't get cracked nipples. The feeding in terms of it's not necessarily about the food, but also in terms of how much fluid you're taking so that you have adequate breast milk to be able to sustain the baby. So I think we forget, we talk about the pregnancy part, but we don't prepare in terms of breasts, in terms of how to take care of the any episiotomy or any tear you get down there in terms of ensuring that it heals well. So there's a whole conversation that I think we start having with the mother after she's delivered and she's quite overwhelmed. So I think for us as
Mm.
obstetricians, it would be good to bring this conversation in the antenatal period so that when it flows into the postnatal period.
And the best thing that a pregnant woman and a woman who goes on to give birth can do is to prepare as much as is within your control, because we know some things can go out of the window. But when you have some, even if it's a rudimentary plan,
Mm.
yeah, life can show you stars. But even if it's a rudimentary plan and you start mentally preparing yourself, it can really make a huge difference.
Mm-hmm.
So for me, the things I know, that the three things I knew I did postpartum, the only things I had energy for
Mm-hmm.
was to roll Claricam, because this is a blend of oils specifically chosen to help support women's hormones. So I rolled that faithfully for, I think, 3 to 4 months every single day. Then I created a peri-mist spray, like you're saying, healing of the episti or something.
Episiotomy or the perineal tears.
Yes, those stairs. I had a peri spray which had frankincense and helichrysum, I think I healed pretty quickly,
Mm-hmm.
actually. And then I would use sisters in the shower for self-care. That I when this oil first came out, I didn't like it, but somehow for postpartum it just really worked for me. And this conversation, especially on postpartum, is it's so vast, and it covers so many things. But I think we're just going to kind of finalize our discussion around this. Well-being is in all things, and like we said when we were preparing for this class, that physical issues are heightened and exaggerated when your mental and emotional wellness is out of whack.
That
So
is
do you want to have a conversation? I think we'll just have a conversation around this particular area for pregnant women and a bit say postpartum.
And as practitioners, we just tend to focus on the physical. You're fine. Okay, you deliver, the baby is fine. But we don't think that for us and for all humans, if you're having any emotional triggers, you're having it tends to worsen your physical symptoms. You can imagine you're emotionally drained, you're strained, you're not sleeping, and then you end up having issues with high blood pressure. So we're not saying that it's direct cause, but we're just saying that health is everything. Health is
Yeah.
not just the physical, it's your mental, it's your emotional, all that comes together in terms of saying that someone is healthy or you're having good well-being. Is that the word? Good well-being. So not to forget that, and especially in a setting where that it's antenatal, it's postpartum, especially postpartum. We have a small infant. Yes, you have help, but at the end of the day, you find the baby cries and needs to be fed. The baby is still brought back to you, so you
Yeah.
don't have you're on 3 hour sleep wake cycles if your baby is unwell, if your baby has colic. So you tend to also be forgotten in this setting. Now the new human has come in, and that's fine. The baby is fully dependent on you. But many times you find that the mother then forgets herself, which is understandable, and that can come with its own issues. Because also there are certain issues that can also develop after delivery. Things like high blood pressure, even if you didn't have high blood pressure before, you can still have that after delivery. You can still get infections either of maybe your cesarean site or your episiotomy. So those are still issues that can happen to the mother. But I can just the minute you are stressed and you are not emotionally okay, that can heighten your physical symptoms.
And I agree with you. I feel, one of the things I felt like back in the day, or even not back in the day, I feel like it took me a really long time to adjust,
Mm-hmm.
especially as a new mom. I think the adjustment from maiden to mom was brutal, if I'm being very honest. It wasn't
Mm-hmm.
an easy, you'd expect that you would settle into motherhood like shui, like it's a natural thing, but it wasn't. I think that really surprised me. That really shocked me, and I didn't know where or how to deal with it. So what I did was I journaled when I could, and even that time for journaling was just not there. I was either too exhausted to journal, or the few days I journal, I'd scribble a few things. I remember also trying to get back into exercise because somehow again my brain, my body had caught up with this new phase, but my brain hadn't. So
Mm-hmm.
in my brain, I was still Brie of yesteryear. In my brain, I was still Brie the yogi. In my head, I was still Brie the active person. But my body quickly reminded me, we are in a new phase,
Things
and
have changed.
this is going to take time. I remember the first time I tried to do a push up. Don't ask me what I was trying to do a push up after giving birth. I was just trying to
Mhm.
exercise. But my friends, my core was like jelly, like it did not hold.
Mhm.
And I remember I cried in frustration because I was like, I could, this was something that came easily to me back then. Now it's like literally having to start from scratch. Do you remember Mr. Odida?
Yes.
Mr. Dida said something that stuck with me back then when we joined Form 1. And he said, in this life, you'll always be at the bottom, at the top. You start from baby class, then you get to class 8. You go to Form
Mhm.
1, you're at the bottom, then you get to Form 4, you're at
Get
the
up.
top. You
Mhm.
go to
Mhm.
campus, your first year, you're at the bottom, then you finish your year, you're at the top. In a workplace, you start from the bottom, then you keep going. So I feel like it was the same thing with like
Mhm.
motherhood and having given birth and new, I was going to say given a new birth, but motherhood. Like
Mhm.
I had to start again from scratch. Like I was at a peak at some point, and motherhood was just like woo, ground zero. And now we're steadily climbing the steps on the way to wherever it will take us. But I think I feel as if mothers really need postpartum care, especially postpartum well-being in terms of
Mhm.
mental and emotional well-being needs to be addressed a bit more seriously than we are doing. We
Even
assume, and the range of emotions that come with motherhood and parenthood in general. But wow, it
and
has
also
taken. Sorry.
I was saying also just being kind with the body, as we were saying,
Mm.
can imagine the stretching. You may still have gotten the stretch marks, the loose skin, the excess weight. To just also be kind to yourself in terms of your body postpartum. Because when you're pregnant, yes, you're pregnant, you're focusing on the pregnancy, but now after, just the being kind to yourself in terms of how your body has changed because you've delivered and you've been
Oh,
pregnant and delivered.
that was that. I also think like body image. If there was ever a time where my body image must have really taken a hit, it was just immediately after giving birth. First of all, you're unrecognizable to yourself, and wow, that's a whole conversation. And I pray that with time, especially in the African settings, we will get to a point where practitioners will also incorporate a lot more postpartum support.
Mm.
The other thing I really wish I had was like a pelvic floor
Mm-hmm.
specialist or therapy. I think that would have made a difference,
Mm-hmm.
um, in not just in overall healing, but I think it would have made a difference to some extent.
Mm-hmm. Okay.
So
That's a good thing in terms of sort of creating a postpartum. Mm, I don't call it package, but in terms of breastfeeding support, in terms of pelvic floor support, in terms of psychological support, like
psychological
some sort of
support.
system that you say, okay, you've delivered, and having this set of, um, can I say, practitioners
Yes.
also supporting that journey, because pregnancy has its own, and of course the pediatrician for the baby. But for the mother not to just think postpartum, we're like, okay, baby to the pediatrician, and forgetting that there's the other things going on with you and in your body that would require attention. Okay.
And you have captured it very very correctly. Having this other support system so that your checkups, your after pregnancy checkups
Mm.
now are more holistic. And
Mm-hmm.
like when you do that 6 week checkup where you just come and you're asked, what did you ask me? I can't even remember.
I usually ask about how the episiotomy is in terms of pain and how you're coping with the baby. I always try to say, how are you coping? But also, that's when we talk about contraceptive. Like, we move on to, okay, contraceptive.
Yeah, if you don't want to just get pregnant almost immediately. But it's true. So I think we also just need to really rethink our whole postpartum care. I personally, as Brie, with
Mhm.
no offense to the medical industry, I feel like that is particularly lacking in terms of support for women. So if we would support women through like the three, especially the four. See, they normally say that the 3 months after pregnancy is the fourth trimester.
So yeah, the fourth trimester is, yes, now after delivery, and it takes your body. I mean, we say by the time your hormones of pregnancy are done, usually about 6 weeks. That's why that 6 week visit. It's
Uh-huh.
assumed that you should be essentially, like, all the hormonal changes, all the changes that had happened in your body to prepare for pregnancy, has sort of gone back to pre-pregnancy state. But you see that it may not be clearly evident to the mother because she's still in a journey. So we end that sort of postpartum period at 6 weeks, and we tell the mother, okay, you can go away, just come back when you have a problem. But
Oh
that may
wow.
not be enough in terms of postpartum care, now that I think about it.
Oh wow, okay. I had no idea that that was the rationale around it. But you guys, oh my goodness, I feel like we have compressed quite a bit
Mhm.
of information in
Mhm.
this conversation. I feel like there's like room for more. Like there's room
Yes.
to address a lot more. But I pray that this particular hour and almost a half has been
Mm.
useful to someone, has given you an idea around pregnancy. Pregnancy is supposed to be one of the most joyous and transformative periods, but for many people it's not. The
Mhm.
reality is that it does have a couple of challenges here and there, but the good thing is that there is help. So how can people find you? How can if somebody wants to take you on as their gyna, as their OB? Yeah.
Oh,
I'm correct.
okay. I'll give you my card to share, but I'm based at Nairobi Hospital, Doctors Plaza. I'll share my office contact number that you can call and talk to the receptionist, and then she'll schedule you in for an appointment. Do I just say the number?
No, I'm going to. I think I'm going to put it on the comment so
Yeah,
that it's in the
yeah.
description so that it's there like really permanently for those who want. So as we kind of wind up, I'm just gonna, like I've said, the next class is a sleep. No more counting
Mm-hmm.
sheep. Next month we're going to be doing this on the first Saturday, same time on YouTube. We're going to be joined by a sleep training expert, a sleep specialist. I'm excited for us to just really learn about sleep. But Dr. Flavia, thank you so much. I feel like I've also learned a bit more,
Mm-hmm.
a bit more information than I had from my pregnancy. And whatever the case happens, at least I have a bit of knowledge just from listening to you. And you've helped. Reliving that pregnancy journey again has just reminded me how really blessed I was to have you on my team. It was very important to me personally to have somebody who understood my love for essential oils and understood that I was going to use them, whatever the case, I was going to use them to support my pregnancy journey. And I also want to just really thank you for joining me on this class and for sharing your knowledge with us and sharing your time. So I thank you for that. Do you have any final comments that you would like to make?
Thank you so much for having me. This was fun.
It
um,
was, right?
it really was, and I think you've also given me like a perspective. Like it's ended with me thinking about especially the postpartum period and that kind of support in terms of mothers, not just the pregnancy part. So it's also left me thinking, and I think that's always a good thing when you
Mm.
have an interaction and it makes you think, I hadn't considered that as much as I thought I had. And if it also improves my practice or practice of anyone who's listening, I think that's worthwhile.
Oh wow,
Thank
yeah, yeah, you're very correct. As long as one person can look and say we can
you.
improve this, at the
Mm-hmm.
end of the day, we are looking not just to make sure we have healthy babies, but we have healthy mothers. We
Yes,
have
mother gets
healthy
lost.
mothers,
Mm-hmm.
because if you talk to many, I'm sure if mothers were to share the struggles of
Mm-hmm.
motherhood, and
Mm-hmm.
this is not as if it is exaggerating, but it's a reality that we have to address. And once we expose and address something, then we can rectify and improve it, so that
And
everybody has. Sorry.
oh, sorry, and also for mothers to be able to seek help, because if everyone is saying it's such a glorious time, which it is, but then now if there's shame around saying, okay, I'm not coping very well, there's shame around saying, okay, I think I need some help, or there's shame around that, then it just, then women are suffering in silence. I think if it's
Mm,
out in the open and it's a conversation that's being had, then someone who's struggling, there may be someone who's not struggling and it's working, but for the person who's struggling, then they can reach out and say, I need help, and so that can make their journey better.
yes, and that is it. Oh, I'm so glad. I'm so glad to have had your perspective on this. It's always really nice to have an expert also come in and share your thoughts around it. And I love that, you see, at the end of the day, medicine and, well, essential oils, at least these particular ones, are not conflicting. Our aim
Mm-hmm.
is to make sure mothers are taken care of, that
Mm-hmm.
mothers have good self-care practices, so that at the
Mm-hmm.
end of the day we have an optimum result. So you guys, thank you for watching this month's class. I pray it has blessed you. I pray it has given you some insight. I pray you have been educated. I pray you have been empowered. And I look forward to hosting you guys in September for our next class. In case you haven't already, be sure to subscribe to the YouTube channel and also just check out the previous wellness classes. I have self-care, I have nurturing your femininity, I have getting started with essential oils, and so many others. Just go through the wellness playlist and that should kind of help you out. So we're going to end the broadcast here, and we shall see you guys next month.
Okay,
Okay.
bye.
And hold on, it's ending.
Okay.
Ending.